Well, you're excited about this, but I don't think anyone's going to be excited about this next topic. It's actually kind of disappointing or maybe even disturbing. The state's Child Fatality Task Force heard a report this week about the state of mental health among North Carolina's young people. Among the key findings of the Youth Risk Behavior Survey, just 49% of students reported feeling good about themselves. That's down from 60% in 2019 before the COVID-19 pandemic. Senator, we're going to start with you on this tough topic. That's got to be something of concern to everyone, but especially people making policy.
Yeah, I mean, look, I think as a parent of 2 kids in public school and as a policymaker, this is of great concern. I mean, I think if you take apart the numbers that were put out by this report, also troubling is that half of the students that were lesbian, gay, or bisexual considered suicide versus 15% of their straight counterparts. And for female students, they saw the number of those that considered suicide to jump from 23% 2 years ago to 30%. So we know that mental health is continuing to be challenged. The other part of the report that I found really interesting, it's worth noting that 17% of the students said that they did not go to school because they felt unsafe in some way on the way to school or at school. That's up almost double compared to 5 years ago, and that's a real issue as we confront gun violence in school. I think it's important to recognize, as someone said during the presentation of this report, I mean, this is the only survey we have that uses student voices, and so these are students talking about themselves.